Hi, my name is Julio Meza, and I'm the medical director here at NorthStar Detox and Rehabilitation Center. So when our clients come in, pretty much the staff lets me know the time of arrival. So I try to meet them as soon as I can, because pretty much it's paramount for us to know the overall health of every single one of them. So when I come in, I perform a physical evaluation and also a full history in regards to their past medical history, surgical history, potential comorbidities that the patient can have. Reason being is that some withdrawals can have definitely morbid to potentially even fatal effects on the patient. So knowing every single factor that may affect the process of withdrawal definitely is key to me. Added to that, the physical examination will allow me to know, for example, on some occasions, depending on the route in which substances may be utilized, are there any infections added to the detox? So we need to treat those to avoid any complications. Is there any cardiac problems or any identified heartbeats that might not be within normal when the patient arrives? Same thing with respiratory conditions that can affect them as well and definitely put their life in jeopardy. So all those type of situations need to put in as a group in order for us to be able to decide the best approach. After I meet with them, I perform the adequate evaluation. We establish the potential plan of care to follow in the next few days while they detox, and after that we plan the aftercare. Definitely the problem with substance use disorders, right, is that what it tends to lead to frequent use is fear of withdrawal. It's uncomfortable, and as I mentioned before, potentially fatal as well. Reason being, depending on the substance the client is utilizing, that's how we have specific medications that tend to help for the most part with all the symptoms that the client might present with. But also that's why the physical examination is key, because if there is anything that might interfere with the withdrawal overall, I have to adequate to each patient and individualize the plans that we are to set. So if we are to use a medication, just to give an example, for alcohol use disorder and alcohol withdrawal, they may have a cardiac condition that I need to take into account in order for me to be able to achieve success in the patient to be, one, safe, which is the first key component to make sure that we minimize the potential risks that the patient can have, and second, definitely something that can keep them comfortable without interfering much as well with the capacity of us to evaluate their cognition and as well any other factors that we need to be vigilant when they are admitted for detox. So the initial physical and health assessment is key to us because it allows us to have a roadmap of what we are to pursue when it comes to the plan for detox, because identifying comorbid conditions will allow me to better utilize medications that commonly we use for specific substances, but added to that, we might need adjuvants to prevent any complications that can be really morbid or potentially fatal on our patients. Definitely, our paramount and cornerstone of our treatment always is to keep our patients safe and minimize complications that can lead to fatalities, especially with some specific substances, but added to that, comfort is the next portion that we try to keep our patients in mind, so we can always achieve, one, the safety that we want for them, two, to keep them as comfortable as possible, and they can definitely have trust on us that we have the best intentions to help them on the path to recovery. Clients always will be concerned about the withdrawal. What is it going to feel like? Am I going to endure a lot of suffering? How much suffering am I going to endure? Is there anything that can be done to minimize it? And the fifth is, am I going to be safe? So definitely the fact that, one, definitely having physicians always around here at NorthStar allows us to have that one-to-one direct communication with the patient and explain to them the reasoning behind each one of the approaches that we take. Even though our safety is our main goal, every single time when we add or remove a medication, it's always discussed to the patient, and also we give them the rationale behind the fact of why we're going to add this medication, why these should be removed, why we think that in order for them to be safe and definitely achieve the goals that we have, why adding or removing some medications might be key, and the potential side effects of all of them. So the patient also has a say and input on their treatment. And I think that has allowed us to achieve a lot of success with the patients because they don't feel that I just come in and I just add orders to them. I have a full-blown conversation, even if it's a medication that might not be necessarily related to the withdrawal process in that moment. It might be an antihypertensive that they never took before and they might need. So definitely we always take that approach to have the patient engage and be a part of their treatment plan.